If you're full, you're going out into a plank, okay? And then you're gonna walk your hands back to your feet. So modified, yes, you're doing that. And then come up slow. So that's what's called an inchworm. And then reach up. So I want you to side bend to one side, keeping those hands together, bring your feet together. Come back in, take a breath in, blow it out, go the other side. If you sit a lot, this is a good one just to kind of get at the edge of your chair, just open and close. So you're probably squeezing that back, close, open. I just want to see a big up and over. We're gonna do 5, 1. So out, in, good. 2, 3, 4, 5, good. All right, up, knee hugs. So just gently bringing one knee up. If you can, you're gonna squeeze it towards your chest. If that is too hard, you hold underneath your thigh and just pull up the best you can. If that's still too much, we're just lifting the leg, okay? So open up your stance. So stand wider, there, and then do, there you go. No, you're fine. So every time you lift, think about the leg you're standing on is tight, like you just did. So instead of going down here, you're gonna fall to the ground. So your stomach is in tight, keep your chest up, pull the belly in, squeeze your leg, and then you can feel how, so you're working, but it's also keeping your balance. Our stance again. All right, so those are our knee hugs. So we're here. We're gonna just do some gentle lunges. So we're reaching forward, gently lunge, and you're reaching. So I want you to see yourself in that mirror. So if this is too much, you're gonna either shorten your stance, hands on hips, and only go what you can do. But think about, your butt is going to the back wall, and your chest is up in front of you, so reach. Good. And I want you to now protect that knee. So when you go back, try not to snap that knee back. I want it soft. Soften the knee that you're straightening. There, good. So kind of when you sit back, try not to push it back. Try not to push your knee back, like the straight one. Yeah, so bring it in. Don't let Don't let it go all the way back. Like that, yes, 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 like that. So keep going, let's do a couple more. This way, so right leg's forward, left leg is back. We're gonna it's called like a crescent lunge, but I want you to reach back into extension. So you're lifting back, but we'll do it with a little bit of movement. So you're going from here to here. So we'll do 5 with movement, and then we'll hold the last one. That's 2, 3, 4, 5, stay here. So if you can, you're here, trying to hold up. If it's too much being there, bring your arms down. Yep, mama, bring your arms down. Stick your chest out, get that, there we are. That's it, do you feel that in your hip flexors? Good. Now everyone, let's put our hand on our right thigh, and I want you to reach up to the ceiling with the left leg, with the left hand. The hip of the right leg. 3, 2, 1, good. Stay here, hands on your thigh. We're gonna just lunge forward into that hip flexor a little bit deeper. So if you can, keep that back nice and straight, yep. And then think about lunging down. So if anything, you should feel it here. So this is where you wanna feel it. If for some reason you're getting it in your back, either you're poked out too much or you need to back off a little bit. So you're lunging forward to feel it in the front of the thigh on the left, and then you're more upright if you don't feel it. If you don't feel it, you need to be more extended. 5 rotations, reach down to the floor. Here's 1, open, and down, and then round everything, dip and look down, 2. Round everything. Good, let's add the breath. So breathe in as you look and poke out, breathe in. Blow it out and round. And again, breathe in. And out. Again, breathe in. And out. 5. So we'll work on the inner thigh. So one more in. This is why we have to stretch. This is exactly why we have to stretch. Does this hurt your knee? How to get out, okay. So what I was explaining to you, like when you were doing the one stretch, you were like really like pushing your knee back, which is hyperextension. So if that's what you do, if you naturally like just kind of, the knee just keeps going every time you straighten it, give yourself a little bit. So which means you have to use your thigh muscle to keep here. So I don't want you bent, but I also don't want you all the way locked out because that's gonna just strain your knee. So just give yourself a little bit of a bend, which means you gotta use your quad. So we're just working on the inside. So we're down here doing a little bit of those rotations again. So from the side that's open, so in this case, the right leg, I just want you to open up. The right leg is out, right arm goes up, and then bring it back down on the floor. And just kick your toe out, or you can sit your booty back and reach to the toe. So we're gonna stay here for a little bit. Same thing with that knee, try to protect your knee. So if you need to, give it a slight bend so you're not locked out. Okay, come back up nice and slow. Let's come to the ground. So we're gonna work on the outside of the hips. So piriformis, we're almost done, promise. And if it doesn't bother you, bring the ankle to your opposite knee and then lean back. So your weight is back here and we're just up here. So this might be all you need. This could be it, and this is fine. So we're gonna stay here. If you need more, if you wanna add movement, you can start to move your butt towards your heel and then take your butt back. Yep. So we're just going one hand on your stomach, one hand on your chest. I want you to think about breathing from your belly. So when you breathe in, feel your stomach get large. Breathe out, blow it out through your mouth and feel your stomach go in. So when we do that, we're using our actual diaphragm muscle, which is the muscle that actually helps us breathe. So when we do that, we're actually breathing up here and that's not helping us breathe. So we wanna try not to like let that the shoulders go, hands on your stomach as a cue. Breathe in through your nose, but literally push your stomach out. Feel it get big. And then when you blow out, draw your belly button in. And again, breathe in, belly big. Breathe out, feel the belly go in. Good. And really control the upper body. Breathe in through your nose. Breathe out and pull belly button into spine. Think about belly button going into your spine. That's what you're doing. Breathe in again. It's okay. If you practice, it'll happen. And then breathe out last time. All right, so alignment. So some of it is, you can be taught. Some of it is just how your body is made. So if you're someone who's more hypermobile, meaning you just have lax joints, like your back here, you're just a little bit more flexible. Maybe you're a dancer, gymnast, any of that stuff. Actually, it's a little harder to control this, but there's ways to do it. But you have to be more active on how you do it. So for example, I'm gonna show you just with a basic squat, just because that's usually when most people tell me that that's when they have knee pain or they lunge and it hurts their knees or going up the stairs or getting out of a chair. So when you squat, when I go down, I want to be able to see my foot. It doesn't have to be exact, but I want to look like, okay, my kneecap is over my second and my third toe. So I'm going to sit down, I'm going to look at myself, I can see myself in the mirror. There's a chair behind me, I'm about to sit in my chair, and this is my squat. So if I were to go down and my knees start collapsing like this, if you look at my leg, my ankle is definitely not happy. I have to poke out my booty to get here, and then everything's collapsing, and then my hip. So that's when we talk about like sitting back. It's not that you have to sit back and poke your butt out. It's literally, there's a chair behind you. You're just trying to sit in a chair, like get down. But when you do that, you also want to make sure you're nice and tight through here so your knees stay over. Otherwise, you're either collapsing or you're splaying out. But if you do either one, the ankle, knee, hip is going to feel it. Okay, so the basics is sitting in your chair, stomach's in, my butt is actually in, I'm not poked out, I'm tucked under, which means I'm using my lower abdominals. But then if I were to just follow this line, it would hit my second and my third toe, like that. And then it shouldn't hurt. So if you do a squat, you should not have pain in the front of your knee. You should feel maybe your quads, your butt, like all these working, but it shouldn't be in the front of your knee. So if you do squat and you're like, oh, my knees are hurting, then I would look down, okay, where's my knee? Is my knee going this way? Is it here? Am I doing this? Or am I doing that? Like, those are usually the common faults I see. See a lot of this. This is a very common one because that means your hips are weak. Butt is weak. So we gotta tighten the booty, squeeze the booty, okay? Same thing with lunging. A lunge is a squat. So a lunge is the same thing. It's just a squat that we opened up. But lunging can be hard, and I get it, because these have to do more work. So we're going down into our squat, same position, so I'm not doing that. I'm not doing that, right? It's the same thing. I'm just going down, I look down, oh, there's my second and third toe, and everything is on top. But I'm working all these muscles, even on this leg. So you don't have to lunge super low. You do not have to go down here, no matter what anyone tells you, if it's hurting you. But it's the same thing. You should never really have anterior knee pain. Like, that's not part of a lunge if you're doing it right. And if for some reason you feel it, shift your weight back. Like, think about, okay, let me get away from my knee. So if I just shift my weight back, all this weight went to here and here, and it's out of my mat. It's not your step. So you're doing, that, right? So when you're doing your little shot, try not to snap it back, right? So now we're nice and tight. Where's my knee over my foot? I'm here and I'm just here. Like, I don't have to do all that. I just need to here, right? Same thing. But I noticed like people are just snapping, like just getting there and snap, snap. And I'm like, oh God, like that's just gonna cause. So think about, like, especially when you come up, squeeze, literally, and you can do it as fast as you want, just squeeze. Do your same thing. It's just you're protecting that knee that's on the step. So there's always gonna be a slight bend in your knee instead of a complete extension, okay? The one that would be harder would be